Welcome to Health Talk, Olean General Hospital's health education program. My name is Carrie, and I'm hosting the series of shows that will highlight health and wellness topics. The first series of shows will focus on diabetes. The topics we will cover include definition of diabetes, managing diabetes, testing blood sugar, proper nutrition and meal plans, medications and insulin, diabetes prevention, diabetes in children, and complications. Today's topic will be defining diabetes. With us is Mary Fay, registered dietitian and certified diabetes educator. So Mary, what is diabetes?
Well, the official definition of diabetes is a group of metabolic disorders characterized by high blood glucose levels due to a lack of insulin or insulin resistance. So to make that easier, more simplified, there is an organ in the body called the pancreas, and it produces a hormone called insulin. And that hormone helps control our blood glucose or blood sugar levels. And our body wants to maintain a balance in the body and keep the blood sugar within a certain range in order for our metabolic processes or our body processes to work properly and prevent complications or problems.
So who can get diabetes?
Pretty much anyone can, although there are risk factors that contribute to an increased number in various populations. The number one cause of the greatest number of patients who have diabetes in our country is obesity. Mm-hmm. Obesity leads to the body's inability to use glucose or sugar at every single cell site. Our cells need glucose in order to function and to have the energy they need to do each of what they do. And if the blood glucose level is elevated, it's because the insulin isn't working at that cell site.
So you just have an excess of sugar in your blood.
That's right. And that means if it's in your blood, it's not getting into the cells, and so the cells don't function properly.
So what are some of the signs and symptoms of diabetes?
Well, they vary depending on the type. If it is type 2, which are the greatest number that we see, there are no symptoms or very few, and people don't attribute them to saying, oh, I have diabetes. It could be just being very tired, lethargic through the day, some blurred vision, symptoms that you would think might be because of lack of sleep or other reasons.
Something else.
Now, type 1 diabetes, which is another type, that usually has more well-defined symptoms, such as drinking a lot, going to the bathroom, urinating a lot, being unable to focus on anything, and not feeling well at all, to the point where you can't function.
Now, you say there are different types of diabetes. How many types are there?
Well, there are several different types, but the greatest number are type 1, type 2, and gestational diabetes. So type 1 is the type where the pancreas, or the organ I mentioned that no longer produces the hormone insulin. So the body doesn't work well at all, and they have very high blood glucose levels. 10% of those with diabetes have type 1 diabetes. The other is type 2, and this is the greatest number. 90% of the patients with diabetes have what's called type 2 diabetes, or what used to be called adult onset diabetes. And they require a change in their lifestyle in order to manage that type of diabetes. The other is gestational, and gestational means during pregnancy. So at some point during the pregnancy, the physician does a test and identifies that the blood sugar or blood glucose levels are elevated above what is normal, and that then is defined as gestational diabetes. Even though it might have been type 2 diabetes prior to the pregnancy that had not yet been identified, they still call it gestational diabetes.
How many people would you say in the state have diabetes?
1 out of 12 New Yorkers has diabetes. which is a lot. And pretty much anyone you talk with, oh, my cousin has it, oh, my uncle had it, my grandmother had it. It is very, very common. In the country, 24 million Americans have been diagnosed with diabetes. And then there's another risk group that has what's called prediabetes, meaning they're at great risk for developing type 2 diabetes, and that's 54 million Americans have that.
So is this disease on the rise?
It is, 6 to 7% per year increase. The statistics have doubled in 15 years for the numbers that we have, and that unfortunately also includes children. We're seeing a greater number of cases in children. So it's been deemed an epidemic. That's how many are being seen, and it's a very costly disease.
What do you think is causing this increase?
Well, it's our unhealthy lifestyle in America and worldwide. The increase is not just in the United States, it's worldwide. We have a tendency to eat much more than we should be eating, and as a result put on weight. And when someone is overweight, the way the pancreas and the body works with insulin, there's insulin resistance, so the blood glucose levels are more elevated, and that contributes to the increased incidence, as well as our sedentary lifestyle. We are not a physically active society anymore. We have a button to push for everything. In the old days, women had to wash the clothes and scrub clothes, and now we push a button.
Mm-hmm.
We push a button for our garage door. We push a button for the television. We don't have to do anything. So physical activity has to be engaged on and scheduled in because of the conveniences that we have. So sedentary lifestyle, unhealthy weight, poor eating habits. Nobody cooks anymore. It's very common when I have patients, they don't cook. It's Hot Pockets and pizza and subs and high-calorie items, high-calorie beverages. Our society drinks a lot of our calories, cappuccinos and pop. Mm-hmm. The intake of carbonated beverages is incredible, all contributing to excess calories and excess weight.
Great. So once you do have this disease, how do you treat it?
Well, we call it the triangle of management. There are 3 components of managing diabetes to get to the target blood glucose levels or blood sugar levels. It's physical activity, walking, as simple as walking 30 minutes a day, medications that help either increase the amount of insulin our pancreas produces or allows the insulin, encourages the insulin to work better at every cell site. There are some other medications, other actions in the body that also help keep that blood glucose level down. And then diet, carbohydrate-controlled meals. And much of what we eat in our meal plan are carbohydrates, excess candy, and as I mentioned, mm-hmm. beverages, and very refined foods, white pasta, white bread, all that contribute to high blood glucose levels.
Since this disease is at an epidemic level, there must be a cost to manage it.
Well, it is 30% of the Medicare budget. 30% of the Medicare budget is spent on diabetes management. In New York State alone, we spend almost $13 billion a year in managing diabetes and the complications that come with it. Heart disease and stroke and amputations, blindness. So even our politicians as well as our insurance carriers are, their ears are peaked about this because it is costing so much. So there is more now, more dollars that are now spent on prevention mm-hmm. and discouraging this epidemic that's occurring.
So you speak of prevention, but once you have diabetes, can it ever go away?
You, with weight reduction and healthy lifestyle, can decrease your need for medications, but that glucose intolerance is always there.
So you always have it.
Yes, it's a progressive illness, meaning that over time the pancreas, even though the insulin resistance can be corrected with healthy mm-hmm. lifestyle, that lack of insulin being produced is there, and the pancreas and the beta cells that produce the pancreas continue to decline over time. But you can definitely prevent it by a healthy lifestyle and delay the onset of it.
When you speak of blood glucose level in your blood, what is a good number?
For pre-meal blood glucose levels is 80 to 120. That's what the physician is looking for when he does a fasting blood glucose. If someone doesn't eat all night and then they go have blood work drawn, that's the number the doctor is looking at. Or if someone's doing finger pokes at home, blood glucose testing at home, pre-meal, that's the number they're looking for. Post-meal, what the physician is looking for is under 180. 180 milligrams per deciliter is the actual unit that they're looking at. Although some organizations now are recommending under 160, because if you have elevated blood glucose levels, a lot of damage is occurring in the body. Not only does the patient feel badly, they're tired, they can't function, they can't think, blurred vision, other problems, but getting to those target levels help prevent those complications.
Should everyone be tested?
Anyone over 40, anyone over 25 who has a high BMI, meaning that they're overweight, should be tested, as well as those with a family history, if they have a parent or grandparent, siblings that have it, or they're at other in high ethnic risk groups, Native Americans, Black Americans, Asian Americans, they're high-risk groups, Hispanics, they should be tested even earlier, especially with those other factors.
Is the highest increase in diabetes in children or adults?
The greatest number of newly diagnosed cases are those between the ages of 40 and 55. So it's those who are overweight, poor, unhealthy lifestyle, whose pancreas now is becoming exhausted, meaning it's been overused and overused with the poor diet, and now the numbers are being identified. Physicians are looking for it more when they're doing annual physicals and finding the greater number of cases. The children, the number of cases in children is increasing, not as fast, although the problem with obesity in our children, now 1 out of 3 children is above the recommended weight for their age. We are seeing elevated levels, not to the point of diabetes, but at the impaired glucose tolerance, or at a risk level that says they're heading in that direction.
Would you say that the United States is one of the countries with the highest epidemic increase?
We are. We are one of the top. Industrial nations who live our type of lifestyle, our Western lifestyle, are those with the greatest number of cases. Although China, having the large population that they have, living more like we do now, the McDonald's on every corner, the greater number of least physically active jobs, their numbers are growing as well. But it is worldwide. The World Health Organization is as worried about it as our country and our insurance companies, our healthcare professionals.
Can you test your own blood sugar at home?
Mm-hmm. And that's one of the great innovations in the last 15 to 20 years is it is very easy to test blood sugar at home. There are blood glucose meters that are as small as a little pocket knife, and you can test your blood sugar before meals, after meals. There are various recommendations for when you should test depending on the type of diabetes. But yes, that's a good data point that tells the patient right at home, oh, that piece of cake that I had caused that to be elevated. I didn't get my walk-in today, or I have an infection. There are a lot of reasons why the blood glucose level can be elevated. But yeah, blood glucose testing is easy at home.
Is one type more difficult to deal with than the other? Is it worse to have type 1 or worse to have type 2?
I think type 2 because, first of all, it's insidious. A patient doesn't know that they have it, and they then go for years until they have a complication, and it's every day living with that. Type 1 is critical insofar as if someone doesn't take their insulin injection, they're in the emergency room within 24 hours. So it's kind of different critical reasons and difficulties in managing the disease. But it is a chronic disease that every day has to be dealt with, no matter what type.
We're just about out of time for this segment, and we encourage you to watch the upcoming shows for the rest of the series. For more information, visit us at www.ogh.org. You've been watching Health Talk.